Hello everyone, welcome to another lecture. We're going to look at skin infections today. Skin infections. Let's start with lice. Lice are parasitic insects that can be found on people's heads and bodies. Human lice survive by feeding on human blood. Lice found on each area of the body are different from each other. The three types of lice that live on humans are Pediculus humanus capitis, or a head louse, Pediculus humanus corporis, or a body louse, Thyris pubis, or crab louse. Okay. Now, lice infestations, pediculosis and thyrsiasis, are spread most commonly by close person-to-person contact. They're found mainly in children who go to school, especially just after the holidays. They're found in both clean and dirty hair. They feed on human blood. They do not always cause itching. Cannot be killed by regular shampoos, but can be eliminated by using special head lice medication. They do not transmit disease. Do not live on pets. So what are the symptoms of lice? Itching is a hallmark symptom caused by allergic reaction. Lice bit the skin and feed on person's skin, which leads to allergic reaction and itching. Okay, let's start with head lice. So head lice and the eggs can be seen on hair, naps, and ears. They can vary in color from white to brown and gray. Eggs are tiny, round, or oval that are tightly attached to the hair near the scalp. So let's have a look at pubic lice. Pubic lice is itching around the genitals as well as the anus, armpits, eyelashes, and other body's area with hair. Pubic lice bite may cause small, flat, blue-gray marks that look like bruises on the torso, thighs, or upper arm. Pubic lice that infect eyelashes and eyelids may cause irritation and crusting in those areas. Pubic lice tend to spread by sexual contact. Okay, let's have a look at body lice. So itchy sores usually develop in armpits around the waist and along the trunk where seams of clothes press against the skin. The lice and eggs are generally not seen on the skin but may be found in the seams of person's clothing. Treatment: check for live lice and nits. Walk in strong light and section the hair. Use a fine tooth comb. A pet flea comb works well to find the insects and to comb them out if possible, or remove them using tweezers. Adult lice are reddish brown. Nits are white or clear and adhere to the hair shaft. They do not jump or fly. Medicated shampoo, cream rinse, or lotion to kill the lice. Medicated lice treatments usually kill the lice and nits, but it may take a few days for the itching to stop. For very resistant lice, an oral medication might be prescribed. Follow the directions exactly because these products are insecticides. Applying too much medication or using it too frequently can increase the risk of causing harm. Follow the directions on the product label to ensure that the treatment works properly. Alright, treatment may be unsuccessful if the medication is not used correctly or if the lice are resistant to it. After treatment, your doctor may suggest combing out the nits with a fine tooth comb and also may recommend repeating treatment in 7 to 10 days to kill any newly hatched nits. Now, check everyone in the household. Lice are very contagious. Wash all bedding, recently used towels, and recently worn clothing in hot water and dry them in a hot dryer. Soak all combs and brushes in hot water for at least 10 minutes. Treat eyelashes and eyebrows with a thick layer of petroleum jelly. Apply twice a day for 8 days. Never use any chemical treatment on eyelashes or eyebrows. Okay, scabies. One of the most commonly discussed diseases and one of the most common contagious diseases, scabies. It's easily spread skin disease caused by a very small species of mite. 8-legged mite cause scabies in humans is microscopic. The female mite burrows just beneath your skin and produces a tunnel in which it deposits eggs. Eggs mature in 21 days and the new mites work their way to the surface of your skin where they mature and can spread to other areas of your skin or to the skin of other people. Close physical contact and less often sharing clothing or bedding with an infected person can spread the mites. Dogs, cats, and humans all are affected by their own distinct species of mite. Each species of mite prefers one specific type of host and doesn't live long away from that preferred host. Symptoms of scabies. Mites that cause scabies burrow into the skin and deposit their eggs, forming a burrow that looks like a pencil mark. Eggs mature in 21 days. Itching, rashes, sores on the skin from scratching and digging. Thin pencil mark lines on the skin. Mites may be more widespread or baby skin, causing pimples over the trunk or small blisters over the palms or the soles. In young children, the head, neck, shoulders, palms, and soles are involved. In older children and adults, the hands, wrists, genitals, and abdomen are involved. What are the complications of scabies? A more severe form of scabies called crusted scabies may affect certain high-risk groups, which include people with chronic health conditions or HIV patients, people who are very ill, such as patients in hospital or nursing facilities. Crusted scabies tend to be crusty and scaly and covers large areas of the body. It's very contagious and can be hard to treat. Diagnosis of scabies can be by microscopic examination by the presence of mites or their eggs. Treatment is by permethrin 5% twice with a week or so between each application. Permethrin is generally considered safe for children and adults. Lindane is usually applied in 2 treatments spaced about a week apart. This medication isn't safe for children younger than 2 years, women who are pregnant or nursing, or people with weakened immune systems. Glutamitone, non-chemical medication, is applied once a day for 2 to 5 days. All of these medications kill the mites promptly. You may find that itching doesn't stop entirely for several weeks. Contact precautions with protective garments, example gowns, when providing care to any patient with crusted scabies until successfully treated. Wash hands thoroughly after providing care to any patient. Isolate patients with crusted scabies from other patients who do not have crusted scabies, and consider assigning a cohort of caretakers to care only for patients with crusted scabies. Maintain contact precautions until skin scrapings from a patient with crusted scabies are negative. Patients with crusted scabies generally must be treated at least twice a week apart. Oral ivermectin may be necessary for successful treatment. Limit the visitors for patients with crusted scabies. Visitors should use the same contact precautions and protective clothing as a staff. Home treatment: cool and soak your skin. Soaking in cool water or applying a cool, wet washcloth to irritated areas of your skin may minimize itching. Apply soothing lotion. Calamine lotion available without a prescription can effectively relieve the pain and itching of minor skin irritations. Take antihistamine. At your doctor's suggestion, you may find that over-the-counter antihistamines relieve the allergic symptoms caused by scabies. Prevention: clean all clothes and linen. Use hot, soapy water to wash all clothing. Towels and bedding use at least 3 days before treatment. Dry with high heat. Starve the mites. Consider placing items you can't wash in a sealed plastic bag and leave it in an out-of-the-way place, such as in your garage, for a couple of weeks. Mites die if they don't eat for a week. Myasis. What is myasis? It's an invasion of tissues by fly larvae. Egg hatch, burrow into the skin. Furuncle with maggots in the center. Cochlemia homnivorix, screwworm. It's the most common wound myasis in USA. Phomia regina, Dermatobia hominis, Cardilobia anthrophaga. Okay, so Hyoscomia bassiana is found in Africa, India, and Southeast Asia. The life cycle and biological activity of bassiana is similar to that of C. homnivorix. These larvae burrow deeper into the host tissues. Only the black tail ends are seen. Only presenting feature of a nasal sinus infection may be a swollen face associated with headaches, fever, burning nasal pain, and nasal discharge. This is an example of myasis. Let's have a look at symptoms of myasis. Infestation sites are exposed areas such as the extremities, back, and the scalp. Within 24 hours, a papule resembling an insect bite will swell into a boil-like lesion ranging anywhere from 10 to 35 mm in diameter. Often there is a small 2 to 3 mm diameter pore at the center of the boil, which allows the larvae to breathe. The patient may experience pain and some have repeated feeling the larvae moving around in the tissues. Treating is surgical removal with local anesthesia. Skin is anesthetized and excised surgically. Otherwise, you can also use lidocaine into the base of the lesion in an attempt to create enough fluid pressure to extrude out the larvae. Other treatments include petroleum jelly, liquid paraffin, beeswax, or heavy oil placed over the central punctum and have been used to coax the larvae to emerge spontaneously headfirst. Larvicides ivermectin is a broad-spectrum antiparasitic that may kill larvae or cause them to migrate out of the skin. Applied topically or as an oral dose. Mineral turpentine can be effective against chrysomel larvae and may aid their removal in case of wound myiasis. Ethanol spray and oil of betel leaf can be used topically to treat omnivorous myiasis. So what nursing interventions are important? What should we be telling the patients? We should notify the patient, calm the patient and the staff. As a nursing staff, we should notify the nurse supervisor or nurse manager, look at the policy or protocol to control myiasis, use standard precautions and remove larvae. Do not smoosh or smash. If entire larvae not visible, apply petroleum jelly, place the larvae in specimen cup, label with patient name, date and time and send to the lab immediately within 24 hours. Place the larvae in specimen cup, clean infected area with sterile saline or hydrogen peroxide, document what was done, broad-spectrum ivermectin is prescribed. Let's have a look at prevention. Prevention: use window screens and mosquito netting, insect repellent and insecticides, educate protective clothing, cover open wounds and change dressings daily. In the case of C. anthrophaga, hang clothes to dry in bright sunlight or iron them. Improve hygiene and sanitation. So what are the risk factors? Risk factors include poor hygiene, open wounds, immunocompromised, warm climate, food containers left uncovered, overflowing garbage bins. Okay, let's have a look at an example. 65-year-old woman with hypertension and diabetes presents to the emergency room with an ulcer on her right leg. Necrotic tissue and tunneling are present in the wound beds. Worms were observed by the nursing assistant. What is a possible clinical presentation? Answer: wound myiasis. Many thanks for watching. Please do not forget to subscribe to our channel and share the videos.